Imagine you're getting ready to cannulate a patient. You wash your hands, you put on your gloves, and disinfect the vascular access. It's a routine you've performed hundreds of times. But do you really know why every one of those steps matters? Why is the patient with hepatitis B treated differently? Why doesn't an HIV positive patient require isolation? And how do you recognize the early signs that a patient may be developing sepsis? You can work in dialysis for years following infection control procedures without fully understanding the science behind them. But today, that's going to change. In this video, we'll work through 10 questions that will help you understand the principles behind infection control and, more importantly, why every step matters. Hi, I'm Miss Magda. I'm a certified nephrology nurse and dialysis instructor. For almost 30 years, I've helped people understand kidney disease and dialysis more clearly. Whether they're building a career in dialysis, caring for patients, or living with kidney disease themselves. I created this series with one goal in mind: to help you become the dialysis professionals your patients deserve. Let's get started with question number one. Number one, standard precautions should be used with A, patients with hepatitis B only, B, patients known to have HIV, C, every patient regardless of diagnosis, B, patients with fever. If you chose every patient regardless of diagnosis, you are correct. Standard precautions are used with every patient because you cannot always tell who has an infection. Treating all blood and body fluid as potentially infectious helps reduce the risk of disease transmission. Okay, let's see. Number two. When caring for a patient who is positive for hepatitis B, which practice is most important? A, use the same dialysis station after cleaning it. B, dialyze the patient in a designated hepatitis B isolation room using dedicated equipment. C, wear 2 pairs of gloves. D, place the patient at the end of the treatment floor. If you chose B, dialyze the patient in a designated hepatitis B isolation room using dedicated equipment, you are correct. Patients who are positive for hepatitis B are dialyzed in a separate room with dedicated equipment and supplies to prevent cross-contamination to other patients. And super important that you clean well. The disinfection afterwards is going to be key. The hepatitis B virus can live in a surface for up to 7 days, and it can live in dry blood. So that is why it's so contagious. 3, which statement correctly describes the difference between the hepatitis B surface antigen and the hepatitis B surface antibody? A, both indicate immunity. B, the antigen suggests current infection while the antibody indicates immunity. C, the antibody confirms an active infection. D, they always become positive at the same time. If you chose B, the antigen suggests current infection while the antibody indicates immunity, you are correct. A positive hepatitis B surface antigen suggests the virus is present. A positive surface antibody usually indicates immunity from a vaccine or recovery after an infection. So us as professionals, you will see that when we receive the vaccine, the 3 doses or the 4 doses, whatever it is that you received, and you get your blood tested, you will see that the hepatitis B antibody will be positive, or it'll give you a number, and the number usually is above 10. That means that you are immune. But if the hepatitis B antigen is positive for patients, that means that they are sick and they have active hepatitis B. And these are the ones that need to be in an isolation room. 4, a patient with HIV requires which type of isolation during routine hemodialysis? A, airborne isolation, B, contact isolation, C, a separate dialysis room, D, no special isolation beyond standard precautions. If you chose D, no special isolation beyond standard precautions, you are correct. Patients with HIV are cared for using standard precautions. They do not require isolation simply because they are HIV positive. HIV is not spread through casual contact, the air, or by simply being in the same dialysis unit. The HIV virus is different than the hepatitis B virus, which I just mentioned, that it can live in a surface for up to 7 days and dry in a dry drop of blood. The HIV virus doesn't have a long lifespan after it's outside of the body. So it dies quickly outside of the body. 5, influenza is primarily spread by A, contaminated dialysis water, B, mosquito bites, C, respiratory droplets, D, blood exposure only. If you chose respiratory droplets, you are correct. Influenza spreads mainly through respiratory droplets produced when an infected person coughs, sneezes, or talks. Good hand hygiene and respiratory etiquette help reduce transmission. One thing you'll probably notice throughout this series is that I'm less interested in helping you memorize infection control rules and much more interested in helping you understand why they exist. Because when you understand the why, making the right decision becomes much easier. That's exactly the idea behind my free CHT or CCHT exam quick start guide. I created it to help you focus on the topics that matter most, avoid common study mistakes, and build a smarter study plan instead of trying to memorize everything. You can download it using the link in the description below. All right, let's continue with question number 6. 6. What is the most common type of infection in hemodialysis patients? A, influenza. B, urinary tract infection. C, bloodstream infection. D, pneumonia. If you chose C, bloodstream infection, you are correct. Bloodstream infections are among the most common and most serious infections in hemodialysis patients. Many are related to vascular access, especially central venous catheters, making proper infection prevention practices essential. 7. Which finding is most suggestive of a localized vascular access infection? A, bradycardia. B, redness, warmth, swelling, and drainage at the exit site. C, low blood glucose. D, pale skin. If you chose redness, warmth, swelling, and drainage at the exit site, you are correct. Redness, warmth, swelling, pain, and drainage are common signs of a localized infection and should be reported promptly. 8. Which statement about blood culture collection is correct? A, refrigerate the culture bottles immediately. B, collect the specimen using antiseptic technique and keep the bottles at room temperature. C, freeze the bottles until they are transported. D, blood cultures are usually final within 24 hours. If you chose B, collect the specimen using a septic technique and keep the bottles at room temperature, you are correct. Blood cultures should be collected using strict aseptic technique and kept at room temperature. Final culture results are typically available within about 72 hours. So at the dialysis clinic, we're going to receive some preliminary results. So we'll receive a 24-hour preliminary result, then a 48-hour preliminary result, and then a final result, which is at 72 hours. 9. What is sepsis? A localized skin infection. B, an allergic reaction to antibiotics. C, the body's C, the body's life-threatening response to an infection. D, a bloodstream clot. If you chose C, the body's life-threatening response to an infection, you are correct. Sepsis is a life-threatening condition caused by the body's overwhelming response to an infection. Early recognition and treatment are critical. 10. Which group of findings should make you suspect sepsis? A, fever, redness at the exit site, itching, and muscle cramps. B, fever or hypothermia, chills, confusion, rapid heart rate, and low blood pressure. C, weight gain, hypertension, headache, and elevated phosphorus. D, nausea, constipation, dry skin, and decreased urine output. If you chose B, fever or hypothermia, chills, confusion, rapid heart rate, and low blood pressure, you are correct. Sepsis may present with fever or low body temperature, chills, confusion, rapid heart rate, rapid breathing, and low blood pressure. Prompt recognition can save a patient's life. In my experience, the times that I've recognized this, the patients, almost all of them, had low body temperature, clammy skin, low blood pressure, and an elevated heart rate. Those are the four things that I've seen repeat in all of the patients that I have suspected that they had sepsis, and then it turned out that they did. Every infection prevention step exists for a reason. Once you understand why those practices matter, you'll make better decisions, not only on your certification exam, but every time you care for a patient. Now, let's build on that. Every dialysis treatment depends on safe, purified water. That's why the next video I'd recommend is 10 water treatment questions. Understanding how dialysis water is made safe is essential to protecting every patient you treat. Click here and I'll see you there.